Hello everyone, I'm here today to show you how to insert the IUD, the copper IUD. It's commonly known as Copper T. I know that people have a lot of misconception about the copper IUD. They always think that it's all copper, like it's just this metal T-shaped copper that they put inside of you. And then people get so worried that it's going to move, it's going to leave from your uterus and then climb to somewhere else, I don't know. So I'm here and I hope that I answer some of your questions and display your fears about the Copper T IUD. So this is the female reproductive picture. This is your womb. This is where the baby sits. This is your cervix. That is the entrance of your womb. You go in. This is the lining of your womb. So this where your period comes up. The wall of this lining of your womb passes out monthly as your menstrual period through your cervix, through your vagina, and out onto your pad. This is the top of your uterus, and this is the cavity. This is your ovary, fallopian tubes. So the egg is released from here. It passes through your fallopian tubes, comes in here, meets a sperm that has come in through your vagina up into your womb, fertilizes. Egg and sperm meet here. Together, it has to implant into the wall and starts to grow as a baby. Now, the copper IUD prevents that process in the sense that we put it in here through your vagina, through your cervix. It goes up and then we release it. So it's like a T-shaped, just like uterus. The top of it ends at the top of your uterus. That's the fundus of your uterus. So you see that the edges have copper. You see these edges, the copper? It gives the reaction that prevents the egg and sperm from meeting. Prevents the egg from, when the egg leaves your ovary, prevents it from coming down to meet with the sperm. And it also causes, the copper edges causes a reaction that prevents the fertilization and implantation of the egg and sperm. So yeah, that's how the copper T works. It's really thin. See? It's like plastic. It's flexible. Do you see? It's flexible. The copper is here, here, and here. This is the rope that stays out of your vagina. So when they insert this whole thing goes into your womb. This stays out of your vagina. It wouldn't be this long. You cut it here and only a short tip of it will be seen in the vagina. Yeah, you can feel it, but it doesn't, it's really thin. See? It's like a hair strand kind of. It's really thin. You don't really feel it. You know it's there, you're aware, but it's not as visible as you think it is. This copper IUD is non-hormonal. So it just depends on the copper here and here and here to cause a reaction in your uterus to prevent pregnancy. It doesn't depend on hormones. So it doesn't add hormones to your system, and so you don't have all the side effects that hormonal contraceptives have. And that's really the fears of the copper T IUD. Thank you guys.
If you haven't taken the 2-minute quiz to find out if the IUD is going to be a perfect fit for you, please do. All women are unique. What works for one may not be perfect for the other, so you need to be sure about yourself. The link is below the page in the description. We also have most frequently asked questions about the IUD answered on this page. Just scroll and you'll find all the information you need, including how to book an appointment at the clinic. Cheers.